So, welcome to Care Smarts 360 on Air, a home care podcast. I'm Erin Cal, Senior Sales Consultant at Care Smarts 360. Today, we're diving into a topic that could have your revenue charts looking a whole lot healthier: unclaimed revenue in home healthcare. And who better to help us uncover hidden financial gold than Keith Grunig? Keith isn't just crunching numbers, he's making them work for home care businesses. As the Vice President of Sales and Marketing at Home Care Answers, he's a C suite powerhouse overseeing everything from sales and marketing to business strategy and competitive positioning. This guy doesn't just forecast, he practically predicts the future, landing within 4% of his revenue forecast like some kind of data analytics wizard. He's tripled, even octupled daily revenue, mastered the art of re-engaging former clients, and turned Home Care Answers into a Google ranking powerhouse. And did I mention a 90% close rate after a trial? So if you're leaving money on the table, Keith's here to help you pick it up. Welcome to the podcast, Keith.
Well, thank you.
So we'll jump right into it. First question for you. Billing errors and denied claims are a major source of lost revenue. What strategies can agencies use to reduce denials and streamline reimbursements?
Well, that's a big question that we could spend a lot of time on that. Really, as you look at it, it's got to start with compliance in the very beginning. Because if we're down to the billing and we have an issue, there's a lot of things that have happened before that. We've got to get that need to be straightened out, hopefully up front, so that we can clean it up, so we don't have to clean it up later. For example, in home health intake, do they have a checklist of everything that they need to have in order to accept that patient? And are they adhering to that? We've got a lot of marketers out there that are happy to bring clients on, but maybe they might not share with the referral partner, hey, here's what we need to be able to take this patient on. Right. So intake's got to help with that. The other part is we've got to have beginning of the episode accuracy, and that starts again with intake. But Medicare right now, the number one reason why claims are still denied is non-compliant or incorrect face-to-faces. So that's just low-hanging fruit. And either this face-to-face isn't signed by the doctor, the primary diagnosis is not related, or the coding is incorrect or not related to the primary focus of care, or the referral reason. And doctors aren't very good, frankly, all the time, because they don't know the rules of home health, to be able to share or adequately say what the reason is. Like, for example, doctors refer patients for weakness all the time. Well, weakness is not a PDGM compliant diagnosis code. That can't be the primary diagnosis. Weakness will get you $0 from PDGM, from CMS, for PDGM purposes. So we've now got to tie what's causing that weakness. Is it an infection? Is it dementia? Is it what is the reason of the underlying cause of that condition? And then we can code from there. So sometimes if we can help the doctor understand that, maybe the doctor can help us, or we have to go back to the doctor and say, this doesn't work. Here's a diagnosis. Is this the underlying cause? And then the doctor can sign it and say, yes, that's the underlying cause. Off we go. But if the face-to-face isn't correct from the get, CMS is going to deny right there. Boom. So that's low-hanging fruit for CMS and auditors to get.
Mm-hmm. Yeah, no, that makes sense. And what are some effective strategies agencies can use to reconnect with past clients and drive new revenue streams?
So I look at it from I look at it from a few different ways, but really there's three ways that agency or that any business can kind of gain or improve revenue. First one is existing clients. Is that what can we do to increase our revenue with existing clients? Is that upselling? Is that cross-selling? But we also have to be smart and careful about that, because if we're only contacting our client partners with opportunities to make more money, they get tired of that. Like, how are we helping them and only offer what we think is going to bring value? And sometimes we just have to let it sit and say, all right, we're working on it. We'll talk to them a little bit later. Or, hey, when you get a minute, I'd like to talk to you about something that we're working on that I think will help you in the long run. But if they're only a target of our revenue, then that's not really a partner. We're using them. And I don't think that's a very long-term positive strategy for partner or me. Second one is old clients. How do we reach back to old clients that we have existing relationships with? Some people, they just move on for a different reason. So sometimes there's a leadership change. Who knows why? They maybe there's a contract issue. Who knows? But most of the time, people leave on pretty good terms, and you just keep it warm. You talk to them. How's it going? And we're doing it in a genuine manner. Like I honestly, you were my friend while you were my client, so you're still my friend when you're not my client. How you doing? What's new? Anything we can do? Is there a way that at some point would you consider coming back? And then we let them know of the upsell or the additional things that we're doing to help agencies. We keep them informed so that at
Mhm.
some point they might come back. But it's easy to rewarm the conversation with a friend rather than just start at a cold lead and see where that goes. So
Right.
efficiency is pretty good. And then we have, obviously cold outreach, which is just normal. How do we do this? Cold calling, not the most effective, but sometimes what's what we have to do. And the third one is new revenue streams. So what are we doing to not necessarily leave our core business, but how do we augment our core business through different revenue streams? Maybe it is, hey, we identified a problem that agencies are having, and either we can do it for free, which then is just an add value, or this is like it might cost something because it adds a cost to me. But if there's new revenue streams, hey, look, we're really good at this. Maybe we look at adding training. Maybe we look at adding something else that just rounds out what we're trying to offer. So that's probably three ways that I would suggest on
Mhm.
doing that.
Yeah. And from your experience, what specific compliance challenges do home health agencies face in Utah, and how can they stay ahead of regulatory changes?
So I would broaden that even further from Utah. CMS has national rules. Um, so home health, we're abiding by federal rules. So everybody's pretty much on the same on the same playing field, which is a good thing. I go back to face to faces, and the other thing I look at, there's agencies have got a lot of things going on, specifically home health agencies, skilled care, medical. There's a ton of regulatory changes. There's changes every year. There's staffing challenges. All medical staff understands that. Home health, hospice, home care that's non-medical, there's staffing challenges, which
Mhm.
is there's even some challenge there's even some issues with non-skilled going the 80-20 rule that they're proposing. We don't know where that's going to go. But there's a lot of regulatory changes with staffing challenges. That means we've got fewer people to do things, fewer people to keep eyes on things, fewer people to be informed about what's happening. So that's a real issue that doesn't necessarily even deal with being able to deliver care. It's how many people can we throw at an issue and be aware and be informed of it. There's budget challenges. How much money do agencies have to track that by themselves? Everything has a cost.
Mhm.
There's going to be a line item cost somewhere. It doesn't look like a cost, but how much time are we spending? I have to spend X amount of time looking at regulatory issues. There's going to be a cost to that. Is that worth that cost, or can I maybe have somebody else help me look at regulatory issues while I'm focusing on something else? There's things to do that. For example, coding. Like we do coding in Oasis for skilled agencies, and there's coding updates every year. And if an agency, most agencies, I'd say most, they don't have the bandwidth or the salary or the expertise to have an in-house coder anymore. It's too complicated. So if a smaller agency's got one coder, they have to send them to training. They have to do this. What happens when they get sick? What happens if they go on vacation? They get burned out. They're always behind. Cash flow starts to lag. There's a lot of things. Or partner with somebody we've got to do the regulatory compliance. We're doing the regulatory training. We've got the help. We're tracking that for them so they don't necessarily have to worry about it. And then we keep them informed of here's the changes that are coming or have started. We've on top of it, just something for you to be aware. Or we have Oasis E1 that just started this year. That wasn't a major change to from Oasis E. There's a couple of questions that went away. There's one new question, but we've got that under control. We're just telling them here's what it is.
Mhm.
We're looking at the final rule, and we're going to give them the heads up of here's what's changing. They're obviously going to have to be aware of it because you can outsource a lot of things, but you can't outsource accountability. So we've still got to be accountable to what is happening, but we partner with the right people to help them to keep us aware. Like we can't be an expert in everything. So
Yeah.
we work with the right people to get it right.
Hmm. And how can AI and advanced analytics help agencies recover lost revenue and improve financial forecasting?
So that one's kind of a tricky one. AI is pretty new. We're kind of waiting to see what we're obviously working with it, but AI is only as good as what feeds it.
Yeah.
So if we're feeding it the incorrect information, then it's going to give us back incorrect information. Now, I
Mhm.
think there's some good places for AI with repetitive things that here's a very repetitive process that happens. Can we automate that to reduce human touch and human time? And then the human still is going to look at it and say, yes, that passed the sniff test. That we can help. We're seeing some AI that's trying to perhaps replace human intelligence, and we're seeing a crossover with that, and we're not sure where that's going to go, frankly.
Yeah.
But AI can help make processes easier to make it more predictable, but we're not ready to say it's able to do a clinician's job for it.
Sure.
And if clinicians are thinking AI is going to do their job for them, then it's probably then we're probably going to have an issue
Yeah.
because like it's only as good as the information we feed it.
Right. Yeah. Still early days.
Well, and
And
it's just it's a machine. It doesn't make clinical judgment calls. It doesn't have intuition. It doesn't read between the lines. It's not using decades of experience and saying, all right, here's a pattern that I'm seeing somewhere else. I'm going to apply that here. What does that look like? We're just not there yet, and that's okay.
Mhm. Yeah, absolutely. And then last question for you. Looking ahead, what major trends or regulatory changes do you foresee in 2025 that could impact home health agencies' revenue streams?
Boy, the one that is glaring right now is value-based purchasing. That's the one that I'm seeing that it's helping some agencies and it's hurting some agencies. There's some agencies that still aren't aware of their value-based purchasing impact. So several years ago, CMS came out and said, we're going to do value-based purchasing. We've been trialing it in some states. We're going to give it to everybody. And based on measures, there's OASIS measures, there's process measures, keeping people out of the hospital, and then there's basically client measures to say how happy are they. They're doing all those three things, and then they come up with a score. And depending on that score, they can be they CMS will take away 5%, or they'll give them up to 5% of their revenue. So agencies could take a 5% haircut, or they could get a 5% raise. And most of it's centering towards ±1, ±2, within, I'll call it standard deviations for lack of a better term. It's kind of clustering to the middle. However, there's agencies that are just figuring this out. They're just finding it out now. So, and that information was from 2 years ago. So 2023 impacted 2025 payment. 2024 impacts 2026 payment, but that's already baked. Agency, there's not a whole lot we can do to change that. And so we're seeing some agencies, they're looking at a 3 or 4% decrease. And they just found out this year. Like we sent out an email to our clients and said, here's what we've got, like, look at your value-based purchasing scores and what's it looking like. And some are like, I don't even know what you're talking about. I don't know where to find it. And so here we are, and now they can't change anything. They're just looking at a 3% cut. Boom. Some are higher, some are lower, but that's not a pleasant surprise to find that one. So 2027, so right now in 2025, here we are, middle of February, 2027 payment is being impacted this year right now. So agencies can proactively manage, and there's been several changes to value-based purchasing from last year to this year. So being aware of what's going on, being able to impact or change or plan how am I going to offset this or influence it for better, because we can, if we get better outcomes, then we'll get better reimbursement in 2027. So we're looking forward on how do we do that. Now, from our perspective, we got to get it right. If Oasis is right at the beginning, we got a much better chance of helping people at the end. But if it's not right, then we don't have a whole lot of room to improve and show improvement upon discharge. So then they're kind of shooting themselves in the foot and they don't realize it. What we're doing is highlighting here's areas where we can improve, here's
Mhm.
areas where you guys can improve, and now we're giving people the chance to improve rather than the Oasis score doesn't allow for that. And that's often underscored, frankly, based on what's going on with the patient. They got the following diagnoses. They weren't independent, but the initial scoring said they are independent. When they broke their leg, they're not independent. They never were independent. So now, how do we show improvement if it starts an independent? We don't. So that's a big regulatory thing that we've got that the agencies need to be aware of and proactively manage going forward so that they can give themselves a shot to not continue to have tough times and unnecessary haircuts by their own
Right.
doing. We're going to struggle with cost with rate decreases from CMS in the near future because there's not some big pot of money that says, hey, we're going to just magically give you 5%. The data we're showing them say we're trying to cut cost. You look at your cost reports, they're cutting cost. And so guess what CMS is doing? They're cutting costs, we're going to cut your reimbursement. So it's a self-fulfilling prophecy if we continue to do what we're doing without having data to support that.
Mhm.
Cheapest isn't always the smartest.
Yeah, absolutely. Well, thank you so much, Keith, for sharing your expertise. And to our lovely audience, thank you so much for tuning in. Until next time, I'm Erin Cal signing off.